Welcome to the Pain Free Athlete Podcast. I'm your host, Dana Jones. I am a certified personal trainer, and I'm here to help you achieve your fitness goals without pain. In each episode, I'll share tips and strategies that will help you stay safe and pain-free while you're working out. I'll also interview experts in the field of fitness and pain management. So if you're ready to learn how to stay active and pain-free, then subscribe to the Pain Free Athlete Podcast today.
Okay, so welcome to a super special joint episode of the Pain Free Athlete Podcast and the Body Nerd Show. My name is Alex Ellis, and I'm super stoked to be here with you today because the minute I met Dana, I was like, hello, best friend. Where have you been my whole life? So we're going to do something super special, a little bit different, just to help you learn how to move better and feel better and to continue to move your body with or without pain for whatever it is that you want to do. So, hey, Dana.
Hey, how's it going?
Want to introduce yourself to my audience?
Sure. So I'm Dana Jones, and I am a fitness coach, and I'm also the host of the Pain Free Athlete Podcast. And I just love everything about fitness and trying to do it without it being incredibly inconvenient and painful.
I mean, we also, too, before we hit record, spent 20 minutes talking about all kinds of things in the fitness industry. I was like, my gosh, we got to get started or we are never going to get started.
We ramble.
Again, best friends forever. For those of you who don't know me, as I said, my name is Alex Ellis. I'm the host of the Body Nerd Show podcast. I am a huge nerd, a body nerd. I'm a mobility coach. I have my degree in exercise biology, and I think that anatomy and physiology are not only fun and can be fun, but understanding how your body works can help you to then make a better choice about that next best step. And especially when it comes to understanding pain, if you can have a little bit more understanding of what is going on and why it's happening, that allows you to have a more in-depth conversation with your healthcare provider, right? Instead of just saying, hey, can you fix this? It's, I tried this, that, and the other, and this is what I'm finding. What do you think? Which not only, trust me, I've asked every chiropractor, massage therapist, physical therapist I've worked with, they're like, yes, please, right? It helps us help ourselves when working with our healthcare providers. So I thought it'd be really interesting if we just like busted some myths around movement and pain, because my God, are they pervasive, especially like scroll through social media for like 12 seconds and you're going to find one of these. So why don't we start with no pain, no gain? And like first thoughts when you hear that, Dana, what do you think?
It went away. And then the other day I was scrolling and it totally popped up again. And I was like, what the hell is this? So I hate it because I was in the military and I was also in the fitness industry a long time ago in the very beginnings of, no, not beginnings of time, but like
weights were like stone. Is that what you?
Yeah. In the late 80s when it was like, anyway, but there was that idea that it's not a good workout unless it hurts. We still joke about it, right? The whole idea of, you need, what is it? Or not arm rails, the handrails when you use the toilet after doing leg day and stuff like that, and it's a joke, but I think that it becomes an issue if that is the goal. And that's where I run in terms of me coaching, is trying to get past that mentality of you thinking that this is the right thing, is that I have to not be able to walk out of the gym for it to be an effective workout. No, not my favorite.
Yeah. Well, and especially too, if you are struggling with pain, right? It's like, what do you mean no pain? Like I'm already there. And then also I feel like sometimes, if you are someone experiencing chronic pain or injuries, then you go with that same mentality of no pain, no gain to the treatment, right? The self-care that you might be doing. So instead of, something that's going to be super helpful, you're like, well, I spent 4 hours rolling on my foam roller and now everything is like overstretched and it feels awful. And it's just like, whoa, no. Like it doesn't have to, like you're saying, it doesn't have to be so super extreme. It doesn't have to leave you sweaty to be effective. And I find too, when I'm, teaching people the soft tissue mobilizations to address some pain, we always follow them up with like a strength building activation. And I'm like 3 reps. Okay. Like, cause you're not in the gym, right? We're just trying to teach your nervous system about safety, about movement. But is this enough? I'm like, yes, it is. But I didn't feel sore after it. That's not the goal, right?
Right.
It's like that idea of no pain, no gain is so just like pervasive in everything we do that it shows up all the time, even when it's not healthy.
The visual, right? And
Mhm.
when you have, like, for me, I always remember seeing, like, the drill sergeant looking dude who's, like, totally yoked out, who's, looking at you is like, no pain, no gain, kind of thing. And even, in youth sports, right? That's a
Mhm.
big one. You have kids running over yakking in cans and they're like, I'm fine, and it's like, no, dude, you should not be causing that extreme stress on your body while you're
Mhm.
working out. That's why working out becomes a thing and people have PTSD about working out because they're like, I don't want to do that and I don't want to hurt. Our body's default mechanism is to avoid pain. And if it's going to cause you pain, you're like, no, thanks, I'm out. And then all of a sudden it's been 3 months, 6 months since you've been to the gym because you don't want to hurt.
15 years. No, thank you. I don't want to. So, in your opinion, like, how do we, I'm just like, this is a huge question. How do we even like start to kind of like combat that? Because I feel like even for myself, just be like, well, it's not true is not super helpful when the messages you're seeing on social media or you're hearing from people or even in your own head are just like, no, it has to hurt to be effective. Like, how do you kind of like work through that?
Well, first of all, you clean up your damn social media, and that's what I've done, and it's been
Mhm.
amazing because there's a lot of fat shaming and all
Mhm.
kinds of things that are coming through, and I know that even for myself, like, there are people that I was following that I'm like, "I don't know if I jive with that message." And so, is this really what I wanna subconsciously keep flooding in to my system? And it's like, no. So, that's the first thing. Second thing is I love, Joseph Pilates talks about the fact that no more than 5 reps, and that
Mm.
when you're working out, you could do 3 sets of something, but you do 5 reps because the whole idea is that you're challenging your body in your strength. And if you do 5 reps, I'm guarantee you're probably not gonna be thrown up in a can, so you just do it and you can you could play with those 15 reps however you would like, right? You can gradually increase weight, you can use the same weight, you can do whatever, but you do 3 or 5 reps and then that's it. And,
Mhm.
your body will get stronger, trust me. It will, the
Absolutely.
muscles will stay firm, you will be able to do things that you didn't think you were able to do.
Mhm.
But this idea of doing that 10 to 15 reps or 15 to 20 reps in some instances, you're running into some dangerous biological areas as well, by
Mhm.
doing heavy weights for that many reps.
Yeah. Well, even too, like 5 really, really good repetitions, whether that's in the gym or even part of like, your mobility plan, 5 excellent reps are so much more helpful than like 15 kind of messy ones because you're tired, because your form is off or whatever. Especially around pain, we're not trying to practice the pain.
Right.
Right? So if I'm doing a million reps that are garbage, it's like it's not as helpful than if I were able to do, again, like 5 really good ones, give yourself a gold star, pat yourself on the back, and then like move on with the rest of the day, your day. So I totally I don't know that much about Joseph Pilates. I love Pilates. And now, like having that knowledge, I'm like, oh my gosh, it makes so much sense because Pilates too is all about the precision of the movement rather than just like the volume of it. So I feel like, yeah, when it comes to like no pain, no gain, I feel like, strike that. And then precision is like the most important thing.
For sure.
Man, there's so many of those, like, I just you can see it right now, anyone who's on social media, right? It's like a dark gym, and then there's someone in, like, bright colored spandex, right? And they're just, like, all sweaty, and it's just like, "No pain, no gain," and they're just, like their thighs are, like, so thick, and you're like, "Oh my god," and, like, don't do
And then that conditions us like, "Oh, I have to look like that." Not necessarily,
Mhm.
well, I mean, it does, right? You do have to look like that body, but then there's also that, like, I need to work that hard, and you don't. And those people aren't doing it either. Just
Yeah, I
just so you
know.
know, those videos they're taking breaks. There's editing that's happening. So
Yeah.
if you're falling apart doing a 30-minute video watching somebody else do something, know that they're probably editing unless they're doing it live and then probably not doing the exercises as intense as you think you should be doing.
You know what's even worse? I saw on social media. So my friend Michael Ujoa is another personal trainer who's on Instagram. There are weights that look like they're a 25-pound weight, but only weigh like 5 pounds. So they're even like tricking us through that, which I was just like, the deception. Because also, like, I'm an ethical person. I know you also are an ethical person. And the fact that people just for like views and I mean, ultimately money, right? Like that level of treachery and deception, I'm just like, oh my God, just use the weight or don't. Like, I don't understand this, like, smoke and mirrors.
Yeah. You could destroy yourself with your body weight. You don't need to do it with fake weights.
Seriously, so true. Oh my gosh, the fake weights. Okay. All right. So here's the next myth, and I'm super curious about your take on this, which is that you have to rest when you're injured. Because I feel like the traditional, like, let's say you sprain your ankle, right? You go to urgent care because you're like, it hurts, it's swollen. I'm like super scared. And they're going to tell you to like stay off of it for 2 weeks and like, good luck with that. So tell me more. What are your thoughts on this?
Can I curse?
Yeah, you can.
Oh, that's bullshit. It's the worst thing. And when I've had clients that come in and they're hurt, or they'll text me like, "Oh, I broke my ankle," or something like that. I'm like, "All right, see you Wednesday." And they're like, "What?" And I'm like, "No, we're working out. I mean, you may be in a cast, but the rest of your body can continue to move, and that's fine." And of course, we know that movement promotes healing. So of course you're going to do that. And I'm glad the medical industry has finally kind of caught up with that, because now before you leave the hospital, you have to take a lap. Obviously, there's other reasons, right? Because you have to get rid of the anesthesia that's in your body. You have to show that your bowels are moving and, all that other good stuff. But the reality is that laying there after a hip replacement, knee replacement, or any of those kinds of things is stupid. And it causes more medical complications than if you were actually moving. And they're seeing that less blood clots, any other bounce back kind of ailments that occur from a surgical procedure are not happening anymore if you actually move. And for me, if there's an injury, the only way that you are going to help yourself is by moving. And so if that hamstring hurts and you pulled it, it's not going to magically just disappear, because hamstrings are funny and they have a lot of adhesions in them anyway. And if you don't do anything, those adhesions get tighter and whatever. So then the first time you go back to doing something and you stretch it, you're going to feel discomfort, and then you're going to go, "Oh, it's not time yet." And the reality is that after 6 to 8 weeks, things should be healed.
Yeah.
And you'll find that if you do movement after an injury, that you'll actually heal faster. Ankles, same thing. You grab that towel, and after, 24 hours of icing, then you should be done. And then you should do your little ABCs, and you should do your little toe curls, bringing that dish towel in and pushing it out. And then after, the discomfort lightens up a little bit, then you get a band and you start doing your little presses and whatever you can continue to do. But you'll find you'll actually cut your recovery time down if you do the movement instead of just laying there and being immobile.
Yeah. I mean, definitely for like acute injuries like surgeries and, ankle sprains and things like that. 1,000%, everything you said. I know. And the icing that's the other one. Just like throw ice on it. Rice as a concept, right? Rest, ice, compression, elevation. Um, I feel like over 10 years ago, people were talking about it. And that now, like more traditional doctors, I feel like are just kind of catching up to that. But a huge reason for discomfort after, an acute injury like that is swelling. And how are we going to get the swelling out? It's through movement and maybe some compression, right? I really like the mobility floss to do like, short-term compression to just like literally squish all of the swelling out that you possibly can. Every time I've sprained my ankle, because also body nerd, I'm always experimenting, even on myself, unfortunately. The last like terrible ankle sprain I had, I was like, cool, we have an opportunity here, right? So let me see what feels better if I ice it or if I do, again, something like the mobility floss for compression to like get it out. And icing might decrease the pain, but it's only temporary, right? And there's also then it's numb and like that feels weird. We also don't know how deep ice is able to penetrate. Is it even getting into the joint? Whereas if I'm
No, not in the joint.
numb, if I can do something to get the swelling moving, now I have better range of motion. There's not that swelling compressing the nerves. It feels so much better. I'm not going to go, immediately try to go run a mile. Not that I would anyways. uh, but that being able to move better and quicker, then my brain is learning, oh, we can move freely, right? It doesn't hurt every time I make that step. Because that's the other piece of pain as well, is that your brain is learning that habit. And also pain is protective, right? Let's say your example as well, like I pulled a hamstring and that hamstring is injured, your body's going to tighten everything up around it to protect it from further injury. And that's fantastic, and we want that to happen. But after that 6-week mark, all the tissue is healed. If we're not doing something to address that tension, we're not doing something to address that literal pattern, that habit that your brain has learned, every time I stretch my hamstring, it hurts, then you're just there forever. Right? So we just have to learn a different way to move. That doesn't mean that you can rest it away, because you're not going to spend your whole life resting. Right? So if you want to get back to movement, movement is the key to moving without pain. And also, yes, there's other things you can do. You have a whole rest of your body. I love that. I'm like, what a disappointment for your client too. Like, oh, finally, I'm gonna get some break time. You're like, haha, no.
No, you're there. Well, and even people, like, I've had people who've had knee surgery, and the conversation is, isometric exercises. I
Mhm.
understand that you're an immobilizer and you can't move and whatever, so let's go. And
Yeah.
you can do isometric exercise with that leg,
Yeah.
not just with other stuff, but with that leg, because the minute a scalpel touches your skin, you atrophy. That's just nature. And you'll see it if it's ever happened to you, you'll notice you'll go down about an inch, right? There'll be an inch difference
Yeah.
because
Maybe. Yeah. Yeah.
yeah, your body just freaks out. But if you study so say if it's a procedure that you know that you're have upcoming, you can study for it. You can do exercises, you can do all these mobility things prior to the surgery, and that will also help increase better outcome.
Hmm.
And then, of course, you immediately right afterward, you start moving. And it doesn't have to be these huge, big movements. So we're not telling you to go like
Yeah.
do 500 lunges in your
Oh
driveway,
God.
after having a knee replacement. We're just
Another thing I
asking,
would never ever do regardless.
you could go and do that tightening, and I will tell you, you'll be tired from it. And
Mhm.
because that's about as much as your body can handle. And then
Yeah.
after a week or so, then you do leg lifts with that leg, and you see and you play with it. And then you start the bending, and the flossing is ideal for
Mhm.
everything. Like flossing muscles is fantastic. You should be doing that anyway, because of the
Mhm.
fact that we do a lot of things that cause these adhesions to kind of pick up. So, I mean, you will feel better if you're able to move the way you want to move.
Yeah. The other thing too I want to touch upon is in the kind of chronic pain realm, right? For any of the listeners who are like, okay, fine, but like I've been in pain 2, 3, 4 years, even longer, maybe, right? So movement then, I always think of it sort of like a circle, right? What kind of movement can I do that doesn't create pain, doesn't increase my pain, that feels okay? And that might look like something as simple as, like rolling on a therapy ball. Maybe it's just, propping yourself up in a little bit of, I'm thinking like a teeny tiny stretch, something like a chest opener kind of
Hmm.
situation, and breathing. Like that is also movement. And
Yes.
if we can continue to do movement at whatever level we're at that doesn't increase the pain or make it worse or anything like that, then that is also a conversation with your nervous system, and your brain is going, oh, I can move and it feels okay. What if I like loosen up is like not the right word, but I always just imagine the brain just being like holding so tight.
So there is a loosening that happens.
Right. Of just like, okay, let me like let another inch, right? Another inch of like slack. Let's allow that circle to get a little bit bigger of what movement I can do pain free. And being able to move better without pain is just gradually increasing that circle through consistent practice of pain free movement, whatever that looks like. The key too is that consistency, right? It's a habit like anything else. If I wanted to learn how to ride a unicycle, I would not spend 4 hours one Saturday, decide it was too hard, and then not do it again, right?
Are you sure?
I mean, I probably would actually. I'm like, actually, yeah, I would. But right, it's that consistent practice. Here's like here is an example that I would actually do. I
Okay.
have a trailer that my dad gave to me after he passed. He was the one who backed it up all the time. I feel like you and I have
Yeah.
talked about this. It's a small trailer. It shouldn't be difficult. In
Okay, but
theory,
there's a brain thing.
exactly, exactly. In theory, I understand. Your hand goes at the bottom of the steering wheel. You turn it one way or the other way. The trailer goes that way, like fine. And in my head too, I'm like, you should be practicing this if you ever want to take this trailer out. Have I done that? No. But I know that consistent practice, right, will be the key out of this. It's the
Yes.
same whether you're in pain or you're trying to figure out how to back up a teardrop trailer into the driveway. A little bit every day.
Without taking out the mailboxes.
I already did that in my car once. Yes, exactly. Thankfully, it's light enough I can push it, not by myself. But anyways,
Yeah.
consistent practice.
And I wanted to circle back about the chronic pain sufferer since that was something I was really good at for a while. One of the things that helped me was the tension and release exercises.
Yeah.
Because to me, when you're in a chronic state of suffering, whatever it may be, there's
Mhm.
anxiety is your best friend. You're just elbow and elbow skipping down the road, your pain and your anxiety. So there are some things that you can do to kind of lessen that. And one of them is that gradual muscular tension and release.
Mhm.
And I found that when I did an exercise and possibly I overdid it, at least in my brain, I thought I overdid it. And I was freaking out like the next day, woke up and went, oh no, this hurts. Oh, it's going to ruin my day or whatever crazy cycle my brain.
10 steps backward.
Yeah,
Mhm,
I would just
mhm,
go nuts. And so then I would just lay there and I would breathe because that's always good. And then I would tighten up and it's like, I'm going to squeeze my left hand. I'm going to squeeze my right hand. I'm going to tighten my left calf. I'm going to tighten my right calf. And I just go through everything I could squeeze and release. And then what I found is that my nervous system went, oh, okay. And did that and just kind of relaxed.
mm.
And then I was able to kind of process the other feelings that I had and actually review, did I truly overdo it or is my body just not ready for this? And maybe I need to just go back a little bit instead of doing, whatever 5 reps, I'm doing 3 reps.
Mhm.
And that's kind of what I did. So for those of you who may be in that realm, for me, I suffer from migraines a lot. And so a lot of it is like upper body exercise. And a lot of times I'll just go and I'll do 1 rep of a shoulder press and then I'll just call it a day. And then
Mhm.
the next day I'm like, oh, I'm not in pain. And then I'll just keep doing it every day just
Yeah.
to condition my body that I can do this and I won't instantaneously turn into a headache.
Yeah, that's so like, what a powerful exercise, like, I love that because yeah, it's like rebuilding the trust
Oh,
of
sure.
your brain and your body together, and I think that even just like you're saying too, like that 1 rep, that 1 movement, that 1 contract and relax, like, that counts also, and is at least something you can do rather than feeling that you're just, like, stuck in this pain loop and, like, can't get out of it.
Because it could be it's so isolating. I think is
Mhm.
what it comes down to. It is that if you're somebody like me who kind of defines themselves through their movement, and then you're no longer capable of doing that movement, there's a depression that goes along with it. And, there's so many ways that we can isolate ourselves these days. And why would we want to perpetuate that? So if you could find something where you could start to feel confident and say, well, at least I did one. And again, remember, there are some people who don't do jack shit. So you did
Yep,
one,
yep.
like,
Start, baby.
yeah, that's it. And, you don't have to necessarily look like the crazy people online or whatever. But remember, you're not following them anymore. But you do your 1 rep and you're like, I did that. Yeah. And the other
Yeah.
thing too is also there's other exercises that maybe you supplement with yoga or Pilates or something that's a little bit more gentle. And don't forget, there are crazy people out there that are teaching yoga because there's like power yoga and whatever, and that may not be your jam.
Yeah.
You go do something like yoga with Adrienne and watch her dog play, and while you do your little
Mhm.
downward dog and stuff like that, and just enjoy the
Yeah,
moment to take a breath. It doesn't have
yeah.
to be like, I'm going to do yoga and be the best yogi ever and be shredded and, whatever.
Yeah, I mean, that's also why I created my community, Movement Mavens, was to understand exactly that. Like, how, if I can't do this movement, what else can I do? How is it going to help to serve my goal of getting back to whatever it is? And then also by learning the basics of how to squat in good form, how to hip hinge in good form, how to do an overhead reach in good form. Now I can go with confidence to yoga with Adrienne, to Pilates, to anything and know the fundamentals of movement. So when they say, do this, you can be like, I'm going to make this little micro adjustment for myself because I know that that's going to serve my body better.
And you'll have confidence.
Exactly. Yeah, yeah. Because I mean, even when I was teaching yoga in person, I mean, you could see like people and I do this too. Like I go to class and I turn my brain off. I want you to tell me what to do. But an instructor, whether there's 2 people or 25 or 40, like you said, you don't know necessarily what their experience is, what their training is. Are they actually watching you? Or are they just in their head thinking about what they're teaching? Like you need to understand the fundamentals so you can keep your body performing and safe. And we can't rely on somebody else to do that for us, whether it is an instructor or excuse me, I mean, even a healthcare professional, right? You go in to see your orthopedic surgeon, my knee's been hurting. In 5 minutes, they're not going to know your whole movement history of how you're moving. Like, it takes time to develop that relationship. So develop that relationship with yourself first, and then you can
Advocate.
become, yeah, yeah. I mean, and you don't have to have a degree in exercise biology or kinesiology or any of that to be able to do that for yourself. It doesn't have to be that complicated.
And I think it's easier too, to be perfectly honest to a doctor when you do walk in and you say, these are the things that I've done. This is what I'm noticing, because then you're helping them kind of, funnel it down and get to the core issue, because there could be something wrong.
Yeah.
But also remember that just because something's wrong doesn't mean that you're broken.
Mm-hmm.
And I've talked about this, like I have a torn cartilage in my knee. It hurt when I did it. It hurts every once in a while, but because I've kept all the muscles around it strong, I don't need to have surgery.
Yeah.
I have torn rotator cuff, same thing. I play
Yeah.
softball, I do all the things, and they're really, it's still torn.
Yeah.
You
Well,
know,
I mean,
it
what we
doesn't
talked
have to
about,
be surgically repaired. Anything that's
yes.
torn doesn't always have to be surgically repaired.
Yeah, a structural, as we've already talked about, just because there's something structural there or not, doesn't always equate one to one that you're gonna have pain. Because if that were the case, then, I mean, they've done research studies, and I've talked about this on the Body Nerd show before, of like, MRIs of a bunch of different lower backs, and the presence of disc issues didn't equate with pain. There were people who had disc issues and no pain, and people who had no disc issues and pain. So just because there's a structural issue doesn't mean that you're, determined to have pain for the rest of time, just like you said.
Shout out to the Boulder back study.
Mm-hmm. Heck yeah. I'll link to that in the show notes as well. Okay, I want to do one more myth for sure, because I know you and I could go on for about 16 more hours.
Sure.
And the myth is that pain is just a part of aging, that we just have to accept some pain because you're getting older. What do you have to say for that?
Lies, all lies. No, but we're conditioned that way. I mean, look at the commercials, right? Oh, you have this, you have arthritis. Again, it's all those things. And what people don't realize is that your spine degenerates the minute you take your first steps, because you're putting pressure on it. And as soon as you move, right, things are moving against one another. And that's what the classical term of degeneration is. But you go into a doctor and they're like, oh, you have spinal degeneration, or whatever.
Stenosis. Oh no.
Right. And so immediately you think, oh God, I'm getting old and that's why my back hurts. And it may also be your back may hurt because you're stressed out. It may hurt because there's, other things going on in your life. There may be muscular imbalances that are causing you to feel it there. A lot of times we're opposites, right? So when your back is sore, sometimes it has to do with your front and the lack of mobility to your front. And so that's why hip movement is ideal. But the BS of I have arthritis in my knee. I mean, yes, everybody's got arthritis in a knee. And again, it goes back to that back study, right? Is that not everybody is as reactive to that particular pain. Your old football injury is gone. People are like, oh, I broke my ankle 30 years ago and it's just never been right since. And it still hurts when it rains and all that other stuff. And it's like, okay, but through movement, it won't hurt anymore. And you won't notice that. And that's the thing, is that movement is, the body's floss. And I think our older generations didn't move. I mean, I remember my grandma, she didn't do anything. She sat. She sat in her living room and watched TV. Unfortunately, like watched the news 24/7. So then she was like, everybody's going to die because she's watching murders and whatever all the day. And then she would sit in the car to go to the store, and she'd walk around the store for a little bit, and then she'd come back and she'd sit at somebody else's house or whatever. It's like, so that's all she did was sit. And I watched her totally like concave in,
Become one with the chair.
yeah, because of the fact that she just didn't move. And I look at my mother-in-law right now, and I can't remember how old, she's like 75, and she can go out and hike and do all these things. So we're already showing that we're changing people's mentality about this whole idea of I'm supposed to hurt as I get older. If you keep doing what you're doing, maybe you don't do it at the same rate. You're not going to be able to run marathon at the same time. But hell,
Yeah.
there's like 90-year-olds running marathons, so can't say anything. So I think it's a mentality more than
Yeah.
anything.
Yeah. Well, I mean, and to your point too, like, yes, there are physiological changes that happen as we age. Also, perimenopause, menopause, and the drop in estrogen, it absolutely changes how your body recovers, which in my opinion means that the body maintenance of doing your mobility work, of doing these almost like corrective type of exercises to supplement your workouts become even more important because you don't have the collagen of a 20-year-old.
Well,
And
and
like,
I know for me that's changed because of the fact, so I'm 55 years old, and before I worked out for fun because
right.
I had this body ideal, right? I want to look like this or whatever, crack I was smoking at the time that I decided was going to be a good idea. And now I'm all, oh, I need to do this shit because I want to be able to get up off the ground,
Yep.
with my grandchildren, or I want to be able to walk up the stairs, or because of that fact that because that perimenopause and menopausal stuff is no joke. Like it
Yeah.
will hit you, you'll be surprised, and that's why you should do your research and start adding supplements because of the fact that your body just straight up stops making them. So there is no, I think back when I was a kid, I remember people like women talked about getting through menopause. Like
Mm.
once I got through the
Mhm.
crabbiness of no longer having my cycle, whatever they believed it was a year or something like that, like, mystically God would come down and slap my forehead and then I would be a woman again, except I was a woman that couldn't get pregnant. Yay me. And now you're getting more information and going, oh shit, like you couldn't understand why your mom was so nasty when she was going through
Mhm.
menopause. It's because
Mhm.
her give a shit is done. It's tapped. The tank is empty. Estrogen is gone.
Yep.
So
Yep.
now, like, she doesn't want to hear your crap anymore. Like, there's no more patience. It's all gone out the window. But as a
Yeah.
result of not having that estrogen, then all kinds of wonky shit happens. You do have body pain that will
Mhm.
occur as a lack of, estrogen, right? My
Mhm.
feet were killing me. And I couldn't understand. I had done nothing to my feet every time I stood up and got out of bed or whatever. I was like, what the hell? It was like I was on glass.
Mhm.
Slap that patch on, all that shit's gone now.
Mhm.
So, I mean, there's reasons why you have to
Yeah.
take care of your body and to continue. But back to
Yeah.
my main point is that now I work out because it's a necessity for me to have longevity. And that's what I would like is that if my son and I were talking about it earlier. I'm like, if I tap out, I want to be like, I'm tapping out doing something cool and not
Mhm.
sitting in my
Mhm.
chair watching 24/7 news and being paranoid that aliens are going to come and eat me or something.
Yeah, 100%. I feel like the body maintenance that I do is for that longevity piece that you were talking about, so that I can keep doing the things I want to do and only stop because I decide it's not fun anymore, not
Right.
because an injury has forced me to. And then also too, I feel like you can never have enough muscle mass because also too, as we're aging, it's decreasing. That's happening anyways. So I want to like bulk up as much as I can so that I have something to lose, so that I'm not frail at 70, that I can continue to pick up my groceries and pick up my dog and like get up and down off the floor, which is such an important, just like life skill to be able to
Yes.
have. And so, also, too, if you're listening to this conversation, you're like, where do I even begin? Start there.
Get up off the floor.
Yeah. And if you're like, gosh, I can't even get all the way down to the floor, pick a stool that's high enough that you can get up and down off of and start there on building the strength in your hips and your feet and your core, like all of that. If you take anything from this conversation, let it be that.
Huh?
Sorry, no, I said go ahead. But okay. So yeah, I think we're definitely in agreement that pain is not, it's just because you're older doesn't mean you're going to have pain. And that there are many things that we've touched upon and talked about that are absolutely going to help you to build that resiliency and longevity to maintain your body so that you can keep doing fun stuff no matter what it is, what the time is, whatever. Now, again, as I said, we could go on for like 6 hours. I want to make sure that, people have a reason to come back for our next
Yes. Yeah,
conversation. Yay. So I have for anyone listening who's like, where can I start with movement? If you are experiencing, any discomfort or pain, you have tension, you want to use it to help with your workouts and soreness, or again, you're managing some sort of pain or injury now. I have a bodywork starter guide that's going to talk you through how to get started with therapy balls. So I will link to that in the show notes. And I know, Dana, you also have something that will be helpful for everybody listening
Well,
too.
first I want to shout out to your videos. They're very good.
Thank you.
So if you haven't had, you need to go there because even if you don't purchase, although I suggest that you do purchase because I know for me, I torture my clients with lacrosse balls and I know, and they're horrible. So Alex's balls are amazing. And they're cool, like, they have a soft outer core, so that really helps when you're working on stuff, so that way you're not freaking your body out, and I went through
Mhm.
all the videos and did everything, and it's super cool, and it's totally not the grinding away at adhesions that I was doing, so just wanted to give you a shout out.
For her to work.
It doesn't have to hurt to work. Exactly. And so for me on the chronic pain side, one of the things that helped me, and we didn't get a chance to go into this, and again, we could tease this for another episode, is that for me to have an understanding like where my pain originated with and to really start doing the deep work because it's not as easy as like, oh, I'm just going to start breathing and then all of a sudden my 43 years of migraines are going to just evaporate.
Mhm.
I had to do some work, and for me journaling was a good thing to do. And so one of the things that I offer on my website is this 10-day journaling journey. Essentially is where you kind of get through and you really look at yourself and what may be some of the origin, your origin story of your pain, because everybody has one. And I always say that my pain spoke when I couldn't.
Mhm.
And because I wasn't brave enough to say no or to set boundaries or whatever, but my pain was able to kind of do that for me. And I used that as an excuse for a very long time. And the journaling has helped me figure out where those feelings came from. And my big thing about journaling, and some of you may refer to Nicole Sachs as well, is that you can also rage on the page and
Mhm.
burn that shit though. Don't save it. Don't let
Oh,
your
do
kids
not say
find
it.
it later. Like, don't have you get hit by a car and then somebody read your stuff and be like, oh, damn, she was so sad. No, it's like write it out and get rid of it. But when you write it out, there is this visceral response that your body has. And I remember there was a time, and my mom has passed, so I can say this now so she won't be offended. But as I was journaling about my mother, had this like sharp pain in my shoulder and it was like in the shoulder blade, like in my back, kind of like
Mhm.
where somebody would anyway. And I thought it was really funny that it was like, oh, my mother's a pain in my back. But as I wrote about my feelings around our relationship, all of a sudden that tension in that area just kind of released. And so that's where I see the value in journaling. So I figured
Mhm.
this is a good thing for me to give as a gift. You take 10 days to kind of just settle into it and it gets you started. And then wherever your journaling journey takes you after that, there's plenty of other people out there, especially if you're somebody who suffers from chronic pain.
Yeah. I mean, and that's like, I'm so glad that you shared that as well because, we are not just like a brain in a meat suit, like it is nuanced. And, we definitely talked about that as well. That, yeah, you can't just go after it structurally because you're not just meat.
No.
Right. And like addressing what am I actually feeling? And I know haven't figured it out yet because I need to do some journaling apparently. And is that since my dad passed and the months of his passing is like the process of him dying as well, I'm in more pain now than I've ever been. And
Mm.
it's just trying to figure out for me of like, I tried all the structural stuff and now I'm like, okay, now I have to actually face my feelings and I don't want to do that. It's a very deep, dark pit, but we're going to do it anyways. So what a gift to start there for some people, right? To just like don't waste take it from me. Don't waste your time suffering. Just utilize all the tools that Dana has shared, that I've shared as well, to do something different so that you can feel better. Even if it's just for like a moment, that's still an additional moment that you didn't have.
It's okay to have grief. And I
Yeah.
think a lot of times we don't allow people to have their space to feel vulnerable about the how everything changes. I mean, our lives changed, we're both dadless. And so it's like both of our lives have both of our lives have changed as a result
Mhm.
of no longer having this person.
Mhm.
There's adjustments even with your relationships with your siblings as a result of that person not being there. There's definitely like this weird vacuum that kind of gets created
Mhm.
by their loss. And then you have to navigate all those relationships. And sometimes I think we feel like it's not appropriate to say mean things to people who are being mean to us because of the time. It's like, well, we don't want to upset mom by,
Mhm.
calling you jackass. So I'm not going to say anything. And then all of a sudden you're waking up in the middle of the night because you're squeaking because you're grinding your teeth so bad because you're like,
Mhm.
why didn't I say those 5 things? Boundaries get lost.
Like, Dana, get out of my head. How dare you? I know. Again, best friends forever. I'm so grateful for this conversation, for you, and for the internet bringing us together. This has been super awesome. And so I hope both for your audience and my audience as well that y'all can take a lot away from this conversation. I can say also for myself, I'd love to hear your takeaways. So reach out to us. You can find me on my website, which is 8wellness.com. You can come find me on Instagram. I'm at Hala for Mala. Where do you live? On the
I am.
Yeah, do it. Awesome. Well, I think that's it for now. Not forever, because I think we're definitely gonna have more conversations, but super, super grateful for today. And thanks for having me and thanks for having you. And this was awesome. Okay.